Are you ready to say goodbye to waiting rooms and say hello to convenient and accessible healthcare? Well, Home-Spital is the groundbreaking new mobile application that transforms the way we access healthcare. With its user-friendly interface and revolutionary features, the app is making it easier than ever to manage our health. To tell us more, we joined virtually by the founder and CEO of Home-Spital app, Nkululeko Khumalo. Very good morning to Nkululeko. Thank you so much for joining us. Welcome to Morning Live.
Good morning. Thank you very much, Simpiwe.
What inspired you to create Home-Spital? What is it about and how does it work?
Absolutely. It was many reasons, really, but one that stands out is an incident that a relative of mine was involved in a car accident in an e-hailer. And there happened to be a doctor on a balcony overlooking, the incident coincidentally, and he had his medical kit in his, in his apartment and rushed down quickly to go and actually attend to the accident scene. And he mended, the patient there on the spot, which turned out later to be, a life-saving incident. So that really was one of the biggest triggers in my mind to say, if we could have healthcare accessible to all citizens, really, of initially our country, but we're looking at it, even broader than that, at the palm of your hand.
And what were some of the challenges that you faced while developing Home-Spital?
Oh, there's tons. The medical industry, in essence, is traditionalistic in how, a lot of things operate and a lot of processes have been entrenched and in place for many years.
Yeah.
So to think outside of those traditional processes and having to then look at a platform that would operate in the new, industrial revolution that we are in, and the AI and machine learning, which is the current groundbreaking technology that's changing a lot of business models, was really quite an exciting and challenging feat.
So do you work with a network of hospital groups or a network of medical practitioners, for me to access this app or to start using it?
So in essence, we are looking at the individual private medical practitioners, from your general practitioners to your specialists. We also look at further down the value chain, your nurses, basic nurses and caregivers as well, where we find that a lot of the medical needs that we tend to find in the market, caregivers and nurses are very much equipped and able to provision. And, there is a larger pool of those people in our societies generally. And then in terms of specialists, the pools are smaller, so you really want to make use of their time a lot more optimally and efficiently. And they would then, go on the platform and be able to receive requests from patients on either visits into their practice, or they could then be requested for an outcall into the patient's home, hence the name Home-Spital.
Okay.
We also find that also from a virtual point of view, certain initial consultations can better be done virtually, even prior to meeting in person.
Right. And what are some of the most exciting features of Home-Spital?
So some of the most exciting features, really, it's the virtual consultation. It's the chat facility on the application, where you're able to chat with the medical practitioner just prior to meeting. It is being able to track, being able to see the schedule of the caregiver. If you are requesting a caregiver to go out and look after your loved one, be it your parent or your child,
okay,
you're able to schedule. You can see them clocking in and clocking out of the environment. And what we're seeing from a caregiver perspective especially is that, from a pay point of view, they've largely been exploited at times in the market, and Home-Spital now provides a transparent and open platform for them to be able to earn, decent and fair and equitable wage.
I suppose convenience is at the core of this app, but how do you think this app will change the way people access healthcare?
We hope that it will. We hope that it will because, the Home-Spital concept is one that is being spoken about in the international health communities and activist groups that we ought to take healthcare back into the home where it started, prior to civilization as we know it today. And digitalization is growing and mobile penetration is also increasing. We've had a pandemic that has shown that at any given point in time, there could be a change, to our lives as the human race, and we aren't able to access services the way that we have traditionally always accessed them.
Okay.
So Home-Spital really is really trying to fill in that gap to say, and trying to institute that behavior to say we can do a whole lot more with little.
And how does it protect the privacy and security of its users?
So the we've got a privacy policy that looks at that and that looks at data security and the cybersecurity aspect of things. So we have very strict processes on our side where users cannot access information outside of what is restricted to them on the system. And equally so with medical practitioners or caregivers, they also can only access information which they are rightfully authorized to access.